Okay, today I'm going to go over a lower extremity venous study, and we're going to go ahead and start in the transverse position. We're going to start at the common femoral vein in transverse, and you're going to be right in the groin. You're probably going to have to angle it up a little bit. You're going to take an image at that, and then also take an image of a compression to ensure that there's no thrombus. Move down into the saphenofemoral junction, which is basically the deep and superficial bifurcation. Take an image there, and again with compression. As you move into the femoral vein, which is actually commonly known as the superficial femoral vein, you're going to take an image at proximal with the compression image, an image at mid, and an image in the distal section. The distal section is just as far down as you can go until it kind of disappears and begins to wrap around the leg. And at each three of the proximal, mid, and distals, you're going to take in compression. And from there, we're going to go ahead and, if you can just straighten your leg out a tiny bit. Okay. You're actually going to go behind the leg. You're going to go into the popliteal region. And you're going to, again, put a regular image and a compression image, and then you're going to move into the posterior tibial veins and the perineal veins. These are kind of confusing because since you're on the back of the leg, the posterior tibials are actually more superficial in the image than the perineals are, but you're going to go ahead and get those. Sometimes you can even get them in the same image if they're laying right over the same scanning plane. So again, just a regular image and then image with compression. And again, regular image in the perineal section and with compression. And then basically we want to go ahead and, we're going to go back into the long axis of those vessels, and we're going to take a spectral Doppler image of that as well, so that we can get our correct velocities. So again, go to the common femoral vein and put spectral Doppler on it. Move past the bifurcation of the deep and superficial femoral and just go straight into the proximal section of the femoral vein. And again, put spectral Doppler on that. Move to mid, spectral Doppler, and distal with spectral Doppler. And again, just as distal as you can go before it kind of wraps and disappears on you. And then we're going to go to the popliteal region, find that, and put the spectral Doppler on it, move into the posterior tibial veins and the perineal veins, and put spectral Doppler on both of those as well.